Welcome to Matarenda's Africa News Channel, a peek on President Donald Trump and America's executive orders and how they affect Africa. President Donald Trump signed numerous executive orders on January 20, 2025, his first day back in office. These orders aim to reshape U.S. policies across various sectors with significant implications for both domestic and international affairs, including Africa. Here is a summary of key orders and their potential impact. Immigration and border security. Declared national emergency at the southern border. Authorized military deployment for immigration enforcement. Suspended the U.S. refugee admission program. Redefined birthright citizenship that denies children born to undocumented parents U.S. citizenship. These measures could affect African immigrants and refugees seeking entry to the U.S., potentially reducing opportunities for Africans to study, work, or seek asylum in America. U.S. foreign assistance programs for 90 days and signaled intention to withdraw from the World Health Organization. The suspension of foreign aid could significantly impact African countries relying on U.S. development assistance. WHO withdrawal could harm Africa's healthcare systems, especially during health crises. The U.S. implemented an America First trade policy and withdrew from international climate agreements. These actions may affect trade relations with African countries and impact climate change mitigation efforts, to which many African nations are particularly vulnerable. President Trump's executive orders signaled a significant shift in U.S. policy that could have far-reaching consequences for Africa. The continent may face challenges in areas such as healthcare, climate change mitigation, and economic development due to these policy changes. Trump's withdrawal of the United States from the World Health Organization poses several significant health risks for Africa. Disruption of emergent response efforts. The U.S.-WHO partnership has been crucial in responding to outbreaks like Ebola, Marburg virus, and Mpox in Africa. Without U.S. funding, responses to current and future outbreaks may be delayed or scaled back, increasing the risk of disease transmission and mortality rates in vulnerable regions. The Health Workforce Investment Charter, supported by U.S. contributions, has been addressing severe shortages of health workers in Africa. The withdrawal could undermine efforts to expand Africa's health workforce, leaving many countries ill-equipped to handle healthcare crises and routine care needs. WHO's digital health initiatives in Africa, backed by U.S. funding, have improved vaccination tracking and health data management. Support could lead to resurgence of preventable diseases like measles, polio, and yellow fever. Compromised HIV and AIDS programs. The redirection of funds might weaken testing, treatment, and prevention programs in Africa, jeopardizing progress towards ending HIV as a public health threat by 2030. The US-WHO partnership under the Global Health Security Agenda has strengthened preparedness for pandemics and other health threats in Africa. The withdrawal risks eroding these efforts, leaving countries less prepared to detect and respond to emerging health crises. Organizations like the Africa CDC, which rely heavily on WHO and US's collaboration, may face funding shortfalls. This could force African nations to bear a greater burden of public health financing, potentially diverting resources from other critical sectors like education and infrastructure. Weakened international coordination. The departure could weaken international coordination against global health threats, particularly in low-income regions that rely on WHO assistance. These potential risks highlight the far-reaching consequences of the US withdrawal from the WHO on Africa's health systems and the continent's ability to respond to various health challenges. On the other hand, the potential US withdrawal from WHO funding presents both a challenge and an opportunity for African nations. While it may create immediate funding gaps, it also offers a chance for African countries to take greater control of their healthcare destinies. By mobilizing domestic resources, fostering innovative financing solutions, and strengthening public-private partnerships, African leaders can build more resilient and self-reliant health systems. The recent pledge of $45 million by 14 African countries to the WHO investment round demonstrates that the continent has the capacity to step up. Now is the time for African leadership to harness the continent's wealth of resources and human capital to ensure sustainable, quality health care for Africans. For example, Zimbabwe can leverage its mineral wealth to fund healthcare through a dedicated mineral revenue fund. Here's a brief example. Establish a health mineral fund by allocating a percentage of mineral export revenues, particularly from gold and platinum. Implement a 2% health levy on mineral exports, directing the proceeds to the fund. They then use the fund to purchase essential medical supplies and equipment, upgrade rural health facilities, train and retain healthcare workers, support preventive health programs. Ensure transparency by creating an independent board to oversee fund management and regularly publish financial reports. This approach could help Zimbabwe reduce its dependence on external funding and move closer to meeting the Abuja Declaration target of allowing 15% of the government budget to health. Matarenda's Africa News Channel. Subscribe, follow and share.